Hey, this is Dr. Ty from Premier Orthodontics, and this video we're going to be going over frequently asked questions. So as a reminder, if you haven't yet, make sure to subscribe to the channel, like the video, tap the notification bell as well. So we'll go ahead and get started here. So this first question was a comment on one of our videos. It says, can you explain how the removal of permanent teeth may have negative side effects? It was suggested I remove 2 teeth and I'm so cautious about it because I feel like these teeth are here for a reason. It's making me anxious. It's not even a pain thing for me personally. I'd rather have my jaw broken or palate expanded if I could avoid tooth removal. So one thing to understand is when we are born, we get 2 sets of genes, one from each parent. And so if you can imagine, your mom might give you a very small mouth and your dad gives you really big teeth. And sometimes mathematically, they just don't work out. If you have small jaws and big teeth, there's not going to be room enough in your mouth for all your teeth. And so the teeth have to fit inside of the bone of the jaw. If we try to expand beyond where the bone is, if we try to make room for the teeth without taking them out, 2 things can happen. One is we can expand the teeth beyond the jawbone, and then you actually end up getting gum recession and other bad things where you have long-term problems with the bone and gums of your teeth, and obviously that's not a desired outcome. The other thing that can happen is if we don't have room for the teeth and we start expanding, the teeth will start coming forward, and you may have seen people that look like this. Their teeth just stick really far out of their mouth and it doesn't look good. And so both of those options are not favorable. And if we have to choose between putting the teeth in an unhealthy position or a position that doesn't look good versus taking 2 out, there's no reason not to take teeth out. There's really no negative side effects. So some things that keep coming up on comments and patients in general, they hear that that's going to flatten your face. So again, if you don't have room for the teeth in your mouth and we make them straight and they stick straight out of your mouth, that's not going to make your teeth or face look good. It's actually going to look much better by taking the teeth out and having the proper amount of tooth for the size of your mouth. The other thing some people will worry about is airway. So unfortunately, it's caused by some dental professionals where they feel that patients who have teeth out and we restrict the teeth will restrict the airway. It causes the tongue to go back and restrict the airway. That's one of those things that's really not factual based. They've done a lot of research on this. They found no connection between patients who have extractions and those who have airway problems. So it is true some patients have airway problems in their life. It's something that happens on patients with teeth out and people that never had teeth out. There's really no correlation. And there's lots of people who are very healthy, who have no airway problems, who had teeth out, and those who didn't. So there's really no connection they've been able to find on that. It's just really someone comes in with airway problems, they're like, oh my gosh, they had 2 teeth out for braces, that must have caused it. But there are so many different factors that may go into airway problems, and there's really been no connection on that. So in general, it's not something that's going to have a negative effect. Again, if you don't have room for the teeth in your mouth, your teeth and face are going to look better by having those teeth extracted and leaving them in. And, there is probably some doctors who will try to treat it without taking teeth out, but I can tell you what it's going to look like. It's going to look really overexpanded. That's going to look really proclined. And the number one complaint from our patients is my teeth stick out too far. And almost every time when we look at those patients, if they come back in after having braces out, it's always the patients that were kind of those borderline cases where we said, we can probably do this without taking teeth out. And it's one that in hindsight, they would have looked better. They would have been happier with the result with having teeth out. So again, 20% of our patients get extractions for braces. And out of all those patients, nobody's had airway problems that I'm aware of. Nobody's had a flattened face. Everyone's happy with their results. And you can look back at a lot of our patients in different cases that we've shown. And you can see everybody's teeth looks fantastic by the time they're done. And it's really not something to be worried about. All right, so next question here. Do people still need to continue to wear Invisalign once they are done with their 18-month treatment? For example, wearing them at night. So anytime you move teeth, you need to wear a retainer to keep them in that place. So that doesn't matter if you move teeth with Invisalign or move teeth with braces. If you move teeth, they're not in basically a stable position ever. They're always going to change over time. And so you need to hold them in that position. So there are different types of retainers. One is a clear plastic retainer that looks very similar to Invisalign trays. And so that's 100% fine. We use those a lot. And so those can be worn at night, just like you said. After 18 months of Invisalign, you wear a clear plastic tray at night to maintain that correction. You can also do a permanent retainer or a glued-in retainer. Those work as well. There's also a metal retainer or Holly retainer. So all those are good options, but you need some type of retainer if you want to maintain your correction. So that's just true for any time teeth are moved with braces or Invisalign. All right, so next question says, I had braces as a kid and my teeth are straight, but when I rest my jaw, my front teeth are completely covered by my bottom teeth. I grind my teeth at night and I'm always tired. I would be a candidate for corrective jaw surgery, but I still most likely need braces, trying to decide if I should see a corrective jaw surgeon or not. So based on your description, you said my lower teeth completely cover the top teeth. So that sounds like you likely have an underbite, would be my best guess, where the lower jaw is too far out in front of the top jaw. So what sometimes happens is a kid or a teenager will get their teeth fixed, their bite corrected, but their growth hasn't finished yet, and their lower jaw continues to grow into adulthood, and sometimes that growth makes the bite not correct. So if that's what happened in your case, you definitely may be a candidate for corrective jaw surgery if you do have an underbite. And the process for corrective jaw surgery is generally you need to have braces for a period. It's usually about a year, and then you go to see the oral surgeon. They do the jaw surgery, and then you heal for about 3 months. And then you'll have about 4 to 6 months of braces after the surgery to get your bite to fit together properly. So if this is something you're interested in, the best place to start is usually by visiting an orthodontist. They'll let you know if that is a good plan. And if it is something that they will feel like they want to pursue, they would recommend you to go visit an oral surgeon that they work with to help get this process started. So next question, genuinely curious, does tooth extraction affect your health in any way afterwards? Like getting sick or something like that? So no, getting tooth extractions doesn't affect your teeth. So when you have teeth extracted, your teeth are going to be sore for a period of time. So it's generally like a few days you have a little bit of soreness, but then after about a week or two, you heal 100% and you really don't have any negative side effects. You definitely don't get sick. It doesn't, you may make you more likely to get any kind of illness. And if you get orthodontic treatment after having those teeth out, the space is 100% closed by the time you're done. And no one, including you, will ever be able to tell that you had teeth taken out. So I see patients all the time and they're adults who come in that want to have something fixed. And I see that they have teeth taken out for braces when they had it when they were young. And I let them know, oh, I see you had teeth taken out. A lot of times they don't even realize it because they had it taken out when they were young. Their teeth were corrected. And it's not something that was ever noticeable. They never had any negative side effects. Another thing to point out is there are so many people that have had teeth taken out who are celebrities, who are professional athletes, who are people you see on TV every day, and you can see they're doing pretty well. So one example is Tom Brady, who's the quarterback of the Buccaneers. Again, if you don't have the dentist's eyes, you may not notice, but he had 2 bicuspids taken out on his upper arch. So you can say like he's done pretty well. He's very athletic, he's healthy, he's a good looking guy. Everyone would agree that he's doing just fine in life. He had 2 teeth taken out. Another person is Chris Evans, or Captain America. Again, if you look closely, he had 2 upper bicuspids taken out. And so again, he has not negatively affected his face, hasn't made his profile flat. As far as I can tell, his airway's doing just fine. He doesn't get sick. Professionally, everything else, he's doing just great. So again, having teeth taken out doesn't guarantee you're going to be Tom Brady or Chris Evans, but I can confidently say it's not going to have a negative effect on your life. And it's something that 1 out of 5 orthodontic patients in our office do have teeth taken out, and it's really not something to be worried about. I know it's not something it's fun to have done, but it's really not a big deal. So that was the last question for this video. Hopefully this was helpful. If you have any follow-up questions, feel free to ask them in the comment section below. Like I said, if you haven't yet, make sure to like the video, subscribe to our channel, and tap that bell, and we'll talk to you soon.